wax and relax and all cool. If you're listening to this, then you know what to do. Lay back, let your thoughts sink into the groove. Cause we got a special message and it's just for you. Check it.
As a general disclaimer to anyone who may be listening to this after the fact, any actual educational value is purely incidental. This is a layman discussing, life with chronic illnesses, life with invisible illnesses, with very fortunate to have my friend Chris and his wife Dr. Hillman today, and Mike Dosik has been kind enough to join us. This is a casual conversation. Please don't try to use this for any kind of medical purposes. And let's go with Mike. Why don't you introduce yourself? Tell us a little bit about what you do online.
Sure. So, hi everyone. My name is Mike. I do photography, video editing, I guess you would just say general content creation, voice actor as well. And that's what I do, basically. Should I talk about what I have, or are we going to tackle that later?
No, if you want to talk about that now. I also do want to point out that you're something of an advocate for accountability and chronic illness and spoon theory, spoony life, I guess.
Yes, that is true. Which I guess is a good kind of segue into what I have. So I have major depressive disorder, general anxiety disorders, ADHD, type OCD, C, PTSD, and possibly bipolar. I'm in that spot where the doctor's like, it's possible, not sure, but not 100% comfortable with this. So now I have to go through that whole testing thing. The point is, it's a heck of a cocktail. I don't recommend it.
Yeah, that's less of a Venn diagram and more of like a pentagram.
Yeah. But yeah, because of all that, that's why I've been very outspoken about people who have chronic illnesses, physical or mental or invisible, but because it affects everyone who has those issues. And I think it's important to share, hey, this exists, and understand why a lot of what people think is a certain chronic illness may or may not be accurate.
Right. Yeah, I think destigmatization and awareness, so that people really understand, depression doesn't just mean, oh, you're sad. Everybody gets sad. That's not what it is. It's a serious condition that has, obviously mental ramifications, but it has physical ramifications. It's exhausting. And there can be a lot of pain associated with it. And I think people often really miss the mark when they are considering the severity of some of those illnesses that you struggle with, and not struggle with, but that you manage, because you do manage. You're killing it. You're out there doing accountability, workouts on Instagram, which is so inspiring.
Thank you.
Yeah, well, especially as somebody who has a lot of mobility problems. I mean, I got the alphabet as far as we're pretty similar, but I don't have ADHD. But then on top of that, I have lymphedema and chronic pain from a car accident and things like that. And you're right, it is a hell of a cocktail. And seeing other people, and I think this is for others as well, seeing other people who are visible and present with those issues. Having functional days, but having days where they're not functional, and it's okay for them not to be functional, is important for people to see, because I think we often guilt ourselves because of the casual gaslighting that friends and family can sort of throw our way in dealing with these things in life.
Absolutely. And it's one of those things where the term invisible disability or invisible illness is so, when I first heard that, it stuck with me. And I lost where I was going with it. Hi, like I said, ADHD, but it's fine. Right. It's fine.
And I think one of the things that we have, I've seen you use and that I have used to explain to people is spoon theory. And insofar as that, I guess the shortest definition is that, like, you know, the energy and emotion you have to deal with things takes a toll, and you could look at those things as like spoons. And you know, maybe you use a spoon to get out of bed in the morning, and you use a spoon to brush your teeth, and you use a spoon to shower, do your daily activities, but you only get so many in a day. So, you know, you take a spoon away for everything that you do to get by in your daily life, and then, you know, a person who is healthier or in a different state of health than you will have more. And, you know, you're stuck sometimes. You have to decide, okay, well, I'm out of spoons. Is my day over? Do I try to borrow against tomorrow with interest? You know?
Yeah.
So I think it can be incredibly isolating, and it can be tough to deal with. And I think even having distant support from people and having, you know, accounts like yours where, you know, you're doing really kind things and you're telling people that you love them, and you're doing these great TikToks, I think there's so much value in that. It's very important. I'm sure it just feels, you know, like you're just kind of playing around, but I think it's really something important that you're doing, and the other people in the community who do that, I think it's helping more people than you guys probably know, which is really awesome. And speaking of helping people, we also have Chris Hillman and Dr. Hillman with us. Do you guys want to introduce yourself and tell us a little bit about the clinic?
Just to add to what Mike said real quick, it's everybody talks about time management and no one talks about energy management. But yeah, we are currently in Pensacola, Florida. We spent a lot of time moving around the country and around other countries, and have decided to open up a practice about 2 years ago, maybe? About 2 years ago, based on kind of the old style of family medicine. You know, don't cram everything into 5 minutes with the doctor and 10 minutes with a nurse, and, you know, things like that. We specialize more in, you know, half an hour to upwards of 60 minutes, or sometimes longer, depending on what's wrong with the patient and what's going on currently. And we've kind of based it off of that. Also seeing that, like, uninsured and underinsured and all of the issues with that, we're a practice that does not take insurance. We don't take insurance so that we can lower costs for the patient as well. So instead of your out of pocket is about the same uninsured as it would be insured. We do, most of our follow-ups are always like $40 for a follow-up. So we kind of try to keep everything so we can kind of see those pain patients and those others who can, you know, this way they can afford it and don't have to start digging into pockets they don't have. With that, we also started seeing a lot of the patients who weren't being seen and weren't being treated in the area, at least not treated properly. So we do a lot of HRT and therapy with trans care. We do assessments for marijuana medical usage for the state of Florida. What else? We do osteopathic manipulation, and Dr. Hillman's a DO, Doctor of Osteopathy. So we do manipulation so we can lower the amount of medication needed as well for pain patients. Because the big thing with us was, you know, trying to tackle that issue with opioids and people getting stuck on some myriad of medicines that they feel like they're kind of struggling to remember what's what on a daily basis.
Oh yeah, I have a bucket of prescriptions next to my desk. No, I think that's also really incredible work, and you guys are also working on a documentary, correct?
Yes, we are. Hold on one second.
All right, switching the microphone over.
Hi, how are you?
Good, how are you?
I'm all right.
So yeah, we started a film company, and I've started work on a documentary. Right now the working title is How to Dream. and we're talking to different trans patients who are either have had gender confirming surgery or they are in the process of trying to get gender confirming surgery. And it came up really because in the process of talking to trans patients about starting medical transitioning, part of what I ask is, okay, where do you see your journey going? And some people are interested in surgery, some people aren't. There's a lot of, especially around bottom surgery, a lot of uncertainty and a lot of patients waiting just because they feel like, especially for FTM surgery, that the technology and the techniques aren't really there yet. But a recurring theme in the patients that I've talked to has been, how am I going to pay for this? Whether because their insurance doesn't cover it or they cover it, but you have to see like 3 or 4 different doctors before you'll get approved for surgery.
Right.
Or they're taking 2 and 3 side jobs to try to save up the money to just pay cash, or even going overseas, kind of a medical tourism sort of situation, going to Thailand or other countries, especially in Southeast Asia, to get these procedures done. So I really wanted to take a look at what are these situations, how are these patients approaching their own situation, getting the care that really most professional organizations agree is medically necessary to treat their gender dysphoria and to really live a life in their authentic self.
I think, that's, I feel like that's something that the trans community has in common with chronic illness sufferers, is that, because of this situation that they were born with, or that they realized at some point, they have, something that they're going to have to manage for the rest of their lives, be it with hormones, be it with surgery, and then, oh my gosh, all of the recovery from surgery. And how do you guys approach patients coping with that?
In terms of coping with the financial situation, or?
In terms of coping with the financial situation, in terms of coping with, like, having a consistent level of care ongoing.
So we definitely do everything we can to make sure that they can get in with us for their scheduled follow-ups, regardless of their ability to pay. There have been a couple of patients where I've just said, there's no charge for today's visit. Like, you're good to go home, you're fine. And we'll also at times cover the cost of getting their labs performed so that we can make sure they're on the correct medication, the correct dose of medication. And it's one less thing that they have to worry about. So we have actually set up a specific fund for patient financial assistance. One thing before we actually started doing HRT, the reason it came up in our clinic is because Georgia and Alabama, I think it was sometime last year, time's kind of melding together at this point, but they had tried to pass legislation to ban abortion and ban access to certain forms of birth control. And I made a post on our clinic's Facebook page saying, if you can get to this side of the Florida state line, if you can make it to our clinic, we will manage your birth control for free. There'll be no cost to coming to see the doctor. We'll write your prescription. You'll have a full regular appointment just like any other patient. All you have to do is pay for the birth control. And, we really emphasized affordable forms of birth control like oral contraceptives or Depo-Provera injections, which we absorb the cost of in our clinic.
Wow.
And I was
incredible.
Yeah, and I was contacted in response to that by a woman who is now my nurse. She's a trans woman. Her name is Ariel. She's actually the founder of Transicola, which is a local nonprofit focusing on transgender rights and healthcare. And, she talked to me about the issues around informed consent clinics versus just regular, just gatekeeping techniques where you have to have therapy letters before you can start hormones. And as she laid out the situation, she asked, would you be willing to do HRT through your clinic? And, as I learned more about it, it was like, yeah, sure, this is something that I can do. we continue to develop our program and make sure that, we're covering as many people as possible. Ariel herself is, a great resource to patients, and she makes herself available to answer any questions that they have and to make sure that, their labs are done, make sure their medications are in, make sure they know how to take their medications. If they're taking shots, she instructs them on how to do their own shots. She has been an incredible resource in our clinic and really serving this population.
And it's an underserved population.
Absolutely. Sure. Especially in this area. In Northwest Florida, they refer to us as South Alabama. So if that tells you anything.
Yeah.
Dang.
Oh, man. If you guys have any links for the nonprofits, I would love to include them in the down bar for anybody who's listening.
Sure, I can send that over.
Guys, if you have the means, please support this clinic, because they're really doing incredible work. This is work that's deeply important to a really underserved and sort of disregarded population. I think the medical community tends to, up to a certain point, if you're not dying, a lot of the medical community is like, all right, move along now. And the fact that you guys are doing these extended visits for patients and making sure that they're, feeling safe and listened to, and, like they have some stability as far as their medical care, it's really important.
Absolutely. And I get so many questions about, do you know a trans-friendly gyno provider? Do you know a trans-friendly, insert specialist here? And one of the strengths, I think, of being, board-certified family practice, the only thing essentially that I don't do obstetrics, and I don't do hospital care. I'm strictly outpatient, but I can manage a wide range of things. So I'll have trans men coming in asking, hey, do you know a trans-friendly gyno where I can get my pap smear? And I'm able to say, well, I can do that here for you. That's no problem. And you just see the relief on their face that they don't have to go someplace else. They don't have to have that initial awkward moment that some of my patients have had where they've walked into a gyno office as a male presenting patient, saying, I'm here for a pap smear, and a receptionist just looks at them and says, you're in the wrong place. Right. Or like some of my patients, especially in this area, as in many parts of the country, psychiatric care is not where it should be. I've had a patient go in for an ADHD evaluation. He is let me see. If I'm remembering the correct patient, he's gay, recently come out, was previously married, and instead of addressing the patient's ADHD concerns, the psychiatrist spent the entire time saying, well, does your wife know you're gay? Well, what's going to happen with your relationship? Well, and completely blew past what his presenting concern was, which was uncontrolled ADHD.
Yeah, I've had incredibly compassionate and amazing doctors who've gone above and beyond what they would normally do. I've also had a lot of doctors that, unfortunately, I'm not a trans person. I just can relate to the sort of misdirection of the appointments oftentimes, because I personally have been overweight like my entire life, and I mean like death fat. Like I am fucking fat, and it's like we're working on it. I lost 120 pounds this year, not all of it voluntarily. But huge. That's the first thing a doctor wants to talk to me about.
Yeah, that's common.
I was in the ER 3 times in September for various issues, and every time they wanted to send a dietitian in to talk to me, and I'm like, I don't need a fucking dietitian. I need, what they put me on Dilaudid, which was fine until even that became like an issue at one point with one of the doctors. And then it can be so demoralizing when doctors are not listening to you, or when they are addressing something that's not the reason you're at the appointment. I understand there's morbidities. And that, of course, has to be looked at. It's something, Mike, I'm sure you deal with this. Like, there are so many overlapping symptoms with what you deal with.
Absolutely.
Do you find that sometimes you have to steer back to the main point of your visit sometimes, or do you find that, how has your experience been as far as like medical care, if you don't mind?
Not at all. So, it's funny because I mentioned the possibility of bipolar, and the reason it's like possibility is because my therapist was going, you have enough symptoms that this could be bipolar, but you also have OCD and this other stuff, and those have a lot of overlapping symptoms. And I'm hearing more OCD, but you're also saying things that are very, bipolar. So, and there were times where I feel like he was kind of set in his way of this is just OCD. But it's how do I say this? It was okay though, because I have a wonderful therapist who listens, and something he does a lot is I'll say something and then he'll repeat back what I just said to him. So that way we're both on the same page. And through practices like that, where did I go with this? Hi, ADHD. So it has happened though, and I have not had this to the same extent as you, but I used to be a lot bigger than I am now. I was 192 pounds. I'm now 115, 110, give or take. And that definitely came up more than once when I would go to doctors for issues. Was well, what's your diet like? What's your situation like that? And in all fairness, excess weight can definitely cause issues. I'm not saying it doesn't, but and I will say losing the weight did help, because I had like high cholesterol. Now that's not an issue at all. But I have seen that with myself as well as with other friends, where it's all a doctor will talk about is weight. And it's like, no, it's like, it may be a point, but it's not like, let's steer back to what I'm trying to say. It's like, I'm sad. I'm like, right. I'm self-harming sad. Why are we talking about my weight? You know what I mean?
Yeah. Why are we talking about like my nutrition intake when I'm telling you that my brain is fighting me?
Exactly.
Like, yeah. No, I understand that. And Lex, you guys sort of are really trying to combat that sort of blinder, narrow field of vision kind of thing when you
absolutely
guys do patients,
and I've been through it myself. I have major depression myself. I have anxiety. I have OCD. I personally believe I have PTSD. I couldn't get my therapist to even talk about it. So I've been through it, and I've been through the weight part of things because I was in the Army. And they were trying to control some of my symptoms. They gave me a medication that is known to cause weight gain. And yeah, I gained like 40 or 50 pounds on this medication. And when I talked to the psychiatrist about it, saying, I want something else, I want off, I can't even fit in my uniform now. His response was, well, you need to eat avocado. And he's like, well, I don't like avocado, first off. And second off, I'm not eating any differently than I did before. It's this medication. To which I got, the typical response, and this is something that doctors do and they suck for it, but, well, medications don't contain calories. And it's like, well, they may not contain calories, but they still affect your endocrine system. They still affect your GI system. They still have these other mechanisms of action, these other effects that, yes, will cause weight gain regardless of what the patient themselves are doing. So, go, do something to yourself.
Water retention.
And water retention and all that. And his response was, well, you don't like avocado, but you're going to have to like avocado. It's like, that's not a response. It's not an approach to medical care when I'm telling you that's not the problem. So having been through that, and even getting my fibromyalgia diagnosis, the doctor wanted to write it off as, well, you're a young mother. It's an overuse injury. And it's like, it's not an overuse injury of my entire body. Like, my entire body hurts. My kids come up to hug me and it hurts. You know, my husband comes up to hug me and it hurts. That's not an overuse injury. Like, you forget you're talking to a doctor. You know, I'm not Joe Schmo off the street. You can't punt me off with these stupid comments you're making. You know, so I had to fight for that diagnosis, and it's not even a diagnosis that I wanted. You know, so I bring that to my medical care in that I know there are things that a patient doesn't want to hear. I mean, no patient wants to hear, well, you have clinical depression. No patient wants to hear, well, you have, you know, X diagnosis. But it helps to know what could be wrong and what likely is wrong. You know, and I really try to balance my conversations with patients about, you have this other thing, you got, you know, you told me about, you know, this extra stressor that your family is bringing to the table, especially for a lot of my LGBTQ patients. You know, their families maybe aren't the most supportive. And like, so you have a number of things that could be going on.
Yeah,
so here's what I propose. You know, and I do not take a paternalistic approach to medicine. I do not say, okay, this is what you're going to do. You know, I lay out the options. Sometimes I get a piece of paper out and I write down 1, 2, 3, 4, 5. Here are your options. Tell me what you want or how you want to proceed. And we go from there. You know, I really try to give the patient as much power and as much say in their care as possible. Absolutely.
That agency is so important. It's such a game changer. It can turn you from a seemingly hopeless situation to a light, you know, at the end of the tunnel.
If I can interject really quickly.
Sure, of course, please.
You said something about it's a diagnosis I don't even want. Absolutely. Like, how do I say this? Some people, I get the sense that some people think, especially with invisible illnesses, that people are just using like ADHD and, you know, major depressive disorder and all these other things as an excuse to not do things or this or that. And I'm just like, no, not at all. I want to do things, actually. And
I'd love to be doing shit right now.
Exactly. And I just wanted to bring up and say thank you for bringing that to attention, because a little bit of a personal story, but one of the reasons I'm at the place where I am today is because I pushed myself so hard for others and for work, to the point where it's just because I didn't want to be having these issues, and I didn't want to accept that, and it only makes things worse. And obviously, not a doctor, nor do I play one on the internet, but it's for sure. I'm not gonna be that person. The only advice I can give is what worked for me, and again, even then, still not a doctor. But it's when no one wants this. Nobody wants this stuff. And if people are pushing for a diagnosis, it's usually so that way there's a level, in my experience at least, a level of validation, as well as a means to get the help that one needs. Does that make sense?
Absolutely. It's tough. It's when people want, you know, with invisible illnesses especially, people just think, oh, you're lazy, or you're, you know, you just want to live off the government, or whatever, like, weird, preconceived, fucking colonialist, puritanical bullshit they want to assign to it. I don't think any of us woke up one day and went, you know what I'd really love? Just fucking crippling depression and not being able to get out of bed, or not being able to take a shower today. That would be great. And then I can make people feel bad, or whatever, or I can get out of this or that, you know. It's not a lack of desire. And, you know, it's not even with ADHD or with things like that. It also includes brain fog a lot of the time. And, you know, when that comes into play, then you know, I guess a neurotypical person is going to walk into a room maybe once in a while they forget why they're there. Somebody who has these issues is going to walk into your room, forget why they're there, start 3 other tasks, walk away from those tasks and do something else and take a nap, or you know what I mean? Like
there's a fantastic TikTok I saw that talks about, it was like a guy saying, "Hi everyone, I wrote a song about having ADHD and I want to play it for you." And he goes to sit down, he goes, so I actually originally wrote this on a piano that I bought. It's this one right here. It's a nice piano. I actually kind of spilled coffee on it once, though. I actually made a cup of coffee. Where did I put that? And then he just walks off the video. And it's hilarious because it's so fucking accurate.
Yeah. No, and I think TikTok and Instagram and things like that, as much as people lament a lot of the social media that we use today, there are people doing a lot of really great, important work just by showing up.
Absolutely.
Just showing up sometimes is incredible.
I have learned so much about ADHD and myself in the last 6 months, year through TikTok alone. And it's amazing.
Sorry. I was going to cut in a second. Just to cut in, so
no, go for it.
So the test for one of the tests for ADHD. I was for a long time, about 6 years, I did behavioral health tech as a technician, and I've administered some of the tests, and I've also received the test. And the test is so similar. One of the tests is so similar to the anxiety test that sometimes they can't differentiate the two, and they can't tell whether it's one or the other. And I am in that scenario. For whatever reason, every time I take the test, I wind up on that cusp of they're not sure which it is. I will say I'm on the other end of that spectrum of that brain fog and moving from one thing to another. And instead, my coping mechanism for my attention deficit is to do 6 things at once.
Right.
So the only way I can deal with it, is going the opposite direction from most people. So I have to watch a video while I do some work, while I listen to some music, while I step away to make myself a cup of coffee. Just to get one thing done, I have to do 6.
No, that makes a lot of sense. I've heard a lot of people, that's how they function. It's that thing of, I've always kind of thought of it as you're filling in gaps. So that way, and when you get to like 100% quote unquote, then there's no room to kind of get distracted, I guess you would say. So
it's almost, it focuses you.
Correct.
To sort of multi-focus.
I've always been that way. When I was little, I get like that. Normal projects for school, I needed to do that. Otherwise, my grades would tank.
Yeah, that's so relatable. And it's like, and it's like not even just like the focusing thing, but also just general stimulation. The leg shaking, where it's like your legs just constantly going up and down super quickly. Or remotes for TVs. For as long as I can remember, I would always have a remote in my hand, and I would just keep taking the battery cover on and off and on and off. And those things drove my parents up the goddamn wall. And it would just constantly be like, "Mike, stop doing that." They thought my uncle like imparted the leg shaking thing onto me, and I was like, "No, I've done this forever." And if I'm not doing it, I'm like over. I didn't use this word at the time because I was just a wee lad, but I wasn't getting enough stimulation. Now that I understand it, it's a lot easier to be like, why am I feeling this way? I'm probably not stimulated enough, and then I grab
the miraculous thing is that you can hold on to a remote. I don't think I've actually retained a remote more than a week after I've purchased the TV.
Dude, I feel this so hard. It's actually why I bought another phone case recently, and I made the phone case white so that way when I lost it had that extra contrast, made it easier to find. And little things like that. The term was neurodivergent was a big one for me when I learned that. because if someone, like, obviously a bit of an oversimplification, but the thing of like your mind works differently than someone who is neurotypical was huge for me, because then it's like, okay, so then a lot of the advice that I find on, you know, the internet that's like, how do I focus more, or how do I do this and that, I now know to take that with a, you know, a grain or a cup of salt, because my mind physically works differently.
Right. And it also, it does inform you to a point where, okay, so you start to realize like standard neurotypical resources aren't going to be it for you. So maybe now when you're, you know, Googling, how do I do this? Instead of how do I do this? How do I do this with ADHD, or how do I do this with depression? And I think getting dialed in to whatever your diagnoses are make you a better like advocate for yourself, make you better informed as to, you know, what you need to look for. Because if you don't know what's going on, how can you possibly search for any kind of help or find?
But one of the things I like to actually do is I've delved into philosophy a lot, and then tried to look at it as an aspect of changing my perception to fit my diagnosis. So to fit my life, to be able to function. Okay. And part of that is a time management, as well as like energy management, which energy management is actually a little more important than the time management, in my opinion. Part of what I've done is
Absolutely.
Once a week I've taken to the habit of shutting off sensory. So once a week I'll take a shower or a bath, but I'll do so with just a lantern in the room. So it'll shut out all noise pretty much, because it's an empty room except for the shower. It'll shut out all of the audio and all of the visual to an extent where it's all minimized. So during the week, because I function with doing as many things as at a time, that's a point in time where it just shuts everything down, so I can restart it or reboot.
Well, and that was going to be one of my questions to everybody, is that, you know, that seems like a great way to decompress. And what are some of the things that, you know, you guys do or people can do that's self-care that isn't, you know, put a face mask on, do a mani-pedi? Like, look, those things are great, but that's not going to help with my fucking chronic depression. How do I get out of bed today? How do I, you know what I mean? Like, what do you guys do? Yeah.
Man, that's a really good question. I think for me, it's just doing something that I genuinely want to do, which I know is a very broad, generic answer, but it's easier said than done. But to do something because I genuinely want to do it, without the voices being like, is this work though? Or, you know, are you improving yourself, or this or that? Just something to be like, I want to do this just for the reason of I want to do this. And sometimes that's painting my nails. Sometimes that's putting on my studio headphones and blasting anime opening themes or whatever. It's like, like you laugh, but I know you do the same thing.
Oh yeah, we did a remix of Octopimp's Splash Free cover. So
Gosh, dang it. But it's that sort of thing, because there's plenty of people that get 0 out of painting their nails, and there are people that are like, anime is stupid. Those people are wrong, by the way.
Yeah, very.
But it's that thing of taking time for yourself to do whatever makes you happy, guilt-free. And I understand that guilt-free part is super hard for some people, but yeah, that's kind of what
I take a different approach to that. Like, instead of doing something I want for the week, there's 2 things I do. One is I make a list at the end of the week of things that I did do, so it'll show me that I was productive and I did do things, and kind of accept that while I didn't finish the 8 million other things that I set out to do, at least I got these 6 done. That's one. And then the other is twice a week, I become somebody else and decide not to be me. I tabletop game twice a week. So twice a week, I either run or I play in a tabletop versus some dice RPG. And what that does is that, for me, is I can kind of let everything else go because I can push myself into that.
Sure,
Correct.
yeah, it takes you out of yourself. You're not, everybody's the star in their own movie. And I think some of us really cast ourselves in bit parts, we're in our own heads so much, especially like me as somebody who has anxiety and depression and PTSD and those things. It's one of those things where you're just like, should I be doing this thing that I enjoy? Should I be doing this thing that's a sort of escapist activity? Is that healthy? How often can I do these things before it also becomes
or it becomes a detriment to everybody else, everything else in your life?
Right? Yeah. And even the flip side of that, where I'm just like, I don't know if you guys experience this, but I will just give myself away until I'm borrowing spoons from other people.
Yep.
And it's not out of... I think sometimes you judge yourself so harshly in certain situations. At least for me, I judge myself so harshly sometimes where I'm just like, I need to do things for other people because that will make me valuable.
Gosh, that's so
I think it's
point.
also like, for me, I grew up without ambitions. Like, I just never had any. Still really don't. So there was no, grow up, get a career, do this specific thing, whatever. You wind up instead falling into that, this is what's expected of me. And so you grow up going, okay, well, I'm supposed to go to college. I'm supposed to have a job. I'm supposed to climb the invisible ladder. I'm supposed to do this, that, and the other thing. Throw yourself into those things, and then you find out that those things aren't what they're supposed to be anyway. And
that reminds me of a quote from The Simpsons.
Right?
Sounds like somebody's got a case
and
of the
so for me, it's been more that direction, and then I wind up giving myself away because that's what I can do. It's what I'm good at.
That's interesting, because I feel like I had the opposite situation, because growing up, I knew I wanted to be an artist of some sort, and that's what I study, like what I did in my free time, and when I got to college, and that's when like a lot of my symptoms granted, I had my first mental breakdown when I was in high school, but like it was in college that it was very apparent, like this is going to be a thing that's going to be with me. And when I realized I couldn't, go to college and do that sort of thing, that's when I was lost, because like I had ambitions and I had goals and I had things I wanted to do, and it just all changed. And I'm kind of having this realization as we're having this podcast now, but I fought that for a really long time, and I think I may have fought it too long and too hard, which kind of goes into the topic of acceptance when you think about it. But
yeah, for sure,
it's
it's tough. It's tough because you grow up, at least in America for the most part, you tend to grow up with a certain set of values, and a big selling point, I guess, of the American dream is buying a house, getting married, having a job, having a career, and people joke about like starving artists, and people don't consider art to be like a viable career, which I think is bullshit, by the way. Pay fucking artists. If somebody has commission rates, pay the fucking commission rates. Don't be a dick about it. It may only take an hour for them to do that painting or that song for you or whatever, but it took them years years to get to the point where they can do that for you.
Absolutely.
And on top of that, I think when you're neurodivergent, you internalize so many of the expectations from other people that they become your own expectations somehow, and you didn't even notice it. And
Absolutely.
then you fight with yourself about not meeting those expectations, and it just becomes a vicious cycle. And it's, it can go either way. You can either become like insanely productive and, doing so much, or you can just kind of flatline as far as, getting shit done, having energy, managing your energy. And it spiders into so much of your life. That finding that acceptance, and it's a constant work in progress. I'm nowhere near at the height of that journey yet. But as I've told a lot of people in my life, like they all who are not neurotypical, they often carry so much guilt and so much dislike of themselves because they feel like they should be done by now, or they should be over it by now, or they should be better, or whatever, insert whatever improvement adjectives you want there. And the thing that I have to keep telling people in my life, and myself, very much myself, very often, is everybody is a work in progress at all times. Everybody is if you're not working on yourself, you're probably in the throes of something, because if you're in a place of acceptance, in a place of, really just going with the fact that this is a part of your life, and how do you manage or surpass it? It's a lot of things that we all deal with, a lot of things that a lot of the people I care about deal with, are things that don't just go away. It's not a cold. It doesn't clear up. It gets better. Medications help. Therapy helps. Therapy is incredible. If you think you need therapy, get therapy. It's not going to hurt to have an objective person to talk to. But I think that internal struggle is just as bad as the symptoms of whatever illnesses we carry,
Absolutely. Because it kind of goes back to that thing of, you just want like a handout or whatever. And it's like, no, that's not what I'm saying. It's the, crap, I lost it again. I'm sorry. Like, she's really bad today.
No, don't worry about it.
Hopefully if I say what made me think of this, it'll help. So I have a friend, and I know that they do a lot of different things, and they definitely struggle with some stuff going on in the noggin. And I recently learned that they actually have like a quote unquote office job sort of a deal, which was news to me because I thought maybe they were just doing all their online stuff. And when I learned that, I had like two reactions, and it was like simultaneously. One part was like, oh, that's great. They're working through this, their inner demons and the stuff that they have going on, and that's great. But there was a part of me that just immediately going, they're doing this stuff. Why am I not doing this stuff? What am I doing wrong? What am I missing? And then it becomes this thing of like, I'm happy for them, but I'm also like, why is this not happening for me? Because I think most people in situations like ours it is anything but from a lack of trying. Like, I don't know a single person who did not give it their all. And I would even make an argument, I think this is the case with me, that they gave it their all so hard and so long and so much that it made it worse, if that makes any sense.
Sure, burnout can exacerbate things. And I think fighting yourself in any respect, be it, with mental illness or invisible illness or chronic illness, or even, fighting against yourself in terms of coming out or not coming out. That can be a huge struggle for some people. And it often, a lot of the things that one deals with going through all of these situations have overlap. And a lot of that overlap is people don't take it seriously. And people will often try so hard not to, I guess, quote unquote, give in to whatever they're fighting against, that they often burn themselves out. They have breakdowns. They wind up, it used to be a joke in my area about our high school that, like, the mental institution around here was the finishing school, because so many of the kids I went to high school with ended up in that mental institution at some point or another in their teens. And it's for one reason or another. Some of them were depressed. Some of them had anxiety. Some of them had all of it, had ADHD, PTSD. And when you carry all that trauma, if you're fighting against who you are, like, in your soul as a person, by pretending to be straight or pretending to live up to something that you're not, you internalize that fight. And it's something that is very hard to unlearn. It's so hard to put down the sword,
Yeah, gosh, put down the sword. That's such a good way of putting that situation.
Thank you. Well, and honestly, sometimes I used to wonder if, like, you're really just fighting yourself. So it's sort of shadow boxing, It's you're gonna run yourself down and you're swiping at nothing. There's nothing there that's gonna be productive from that fight.
And like unlearning that is a journey in itself.
Absolutely.
And it's especially when you deal with things like when it comes to like PTSD and like triggers, because it's a lot. It's a lot.
Yeah. And I hate that triggers has become like a buzzword to be like, I feel like there's people have broadly started using the term snowflake as a pejorative. And, if you find something distasteful or if you find something upsetting, you're too sensitive or you're too this, it's too that. Like, it's just a joke. And look, I understand jokes. My favorite saying is, it's a joke, not a dick. Don't take it so hard. Like, seriously. I'm not, I watch a lot of un-PC comedy. I have a lot of un-PC friends. But there's a difference between that and, like, saying something with malice. Saying something publicly that's going to make somebody feel terrible. Or, and everybody is guilty of it at some point. In the history of the internet and, especially in me and Chris's cases, we've been on the internet for quite some time, back when you had to sacrifice a robot to the internet gods to get your fucking connection to AOL, and you were happy. Yeah. I'm sure everybody has said or done something shitty in their lives, but that doesn't like guard them against having shitty things done to them. You know what I mean? Nobody's perfect. Nobody's a saint. At the same time, everybody is going through a battle that nobody has any idea about. And everybody is a human. And we all fuck up. And fucking up is part of being human. But you also have to, I think the biggest thing with coping with all of these things is owning your shit, And that goes for the people that are interacting with you. They need to be owning their shit too. If they put up some kind of like triggering post and a bunch of people get mad about it, at that point, maybe you're the asshole, dude. Maybe it's not just people being sensitive. Maybe you said you had a shitty take on this.
For sure.
And, and look, that shit happens. There's infighting, like, social media is a wonderful and truly terrible blight on society.
It is the definition of the black and white cookie.
It really is. Yeah. And I'm really lucky, because if it weren't for social media during this pandemic, I would have no job. And I wouldn't have started a podcast. I wouldn't be on a Twitch stream and things like that. And I wouldn't have made a bunch of friends in incredible communities, and made a bunch of really meaningful connections this year. And I definitely think social media and online interaction has definitely been one of the huge huge reasons that I have made it through this year, but there have also been times where I'm just like, please yeet me off this planet. I don't want to be on this plane of existence anymore. Because yikes. And I think if people sort of could get to a place of understanding where, like, if 10 people tell you that something you're doing is hurtful to others, and you're still going, no, it's fine, I'm good, because you have, like, somebody who thinks the same way you do telling you that you're cool, like, maybe take the note. It's not like a personal attack. It's like, hey, this isn't fucking cool. And I kind of wish people could be able to sort of take that from each other, you know? If I say, like, hey, that thing you did was shitty and it hurt me, it would be cool if more people that I interacted with on a regular basis could be like, hey, that sucks. I'm sorry I was an asshole. Or, like, not even that, like, hey, that sucks. Even that, like, I don't need an apology from people for every little, like, perceived slight. That would be fucking ridiculous. But if you say some genuinely, like, shitty shit, or you do something shitty, like, cop to your shit, you know? Especially when you don't know what people are dealing with. Excuse me.
If I may.
Yeah.
I went to a high school where the slogan was verbum sap sat, which is a word to the wise. And it was a lot of, take responsibility for your actions. The teachers wouldn't get on students about doing their assignments or this or that. If they didn't, their grades would suffer, but it was the student's responsibility to do that stuff. And I really took that lesson to heart and internalized it, and was like, I gotta take responsibility for my actions. And I'm grateful for that lesson. But at the same time, I'm also really fucking pissed at that lesson, because then when I left high school, I learned nobody's taking responsibility for their actions, and this is really disappointing. Especially when it came to social media.
Oh, yeah. Well, yeah. And, I have had colleagues and former colleagues who have had people come after them to cancel them. In some cases, grossly misinformed. And in other cases, I'm shocked that there aren't more people with pitchforks. And a lot of times, I've tried to discuss with people like, hey, maybe don't post that, or maybe take that post down. Not because it's like a freedom of speech thing. Like, look, it's America. Do your thing. First Amendment. I got you, man. But, like, if it's hurting people and it's not necessary, you know what I mean? There's no real value in it other than you just want it to be a prick. Maybe take it down. Or maybe don't do it in the first place. People who get hurt by things other people do are not being babies. If somebody's upset, I mean, with a grain of salt there. Obviously, if they're not on this plane of existence as far as, like, at least baseline sense of reality, you can't do anything to help that. But, if they're a reasonably functional adult human being, because even kids have to be responsible for themselves, but kids will just say shit, and there's no filter yet. You can't really blame a kid to an extent. Pre-adolescence, I would say. Post-adolescence, everybody gets mean as shit. Unless you're like an angel. But I don't know many tolerable teenagers.
Well, dang.
We have this thing in our house. The big thing is, don't do it if you want it done to yourself, the normal golden rule. And I can't count the number of times I've been in public and been like, stop being a jerk to the 8-year-old who will be like, frozen, and then usually he'll comprehend it and be like, oh. But it's the other parents who make those situations hilarious, because they'll all look at me because I told my kid he was being a jerk. Right. Like, well, I mean, it's not like I'm saying he is a jerk. It's that he's being a jerk. There's a difference. Right. Everybody can be a jerk. And to see, like, if you won't, as a parent, take responsibility to say that or to write your kids, why are you going to be against me doing it for my own? And in that scenario, it's the same as anything else. calling somebody else out for their bullshit, as long as it's done in a constructive way, shouldn't be seen as a crappy thing either. So, it's just very odd to me to see both ends of that, where you have people that are doing stupid things on the internet and being a jerk, and then you have people calling them out, but on both sides, everyone's getting everybody's shit. That makes sense.
Yeah, well, I think the problem is I think a lot of times when it comes to things like that, and especially like the way that people view the stigmas associated with, neurodivergence and things like that, it's very polarized thinking. There's not a whole lot of people sitting in the center of that going, okay, I understand why, neurotypical people could think this because they've never experienced these things. But on the other side of that, I guess, I would say empathy is important no matter what is going on. And compassion for other people and yourself. I think oftentimes people have so little compassion for themselves that they then lack it for other people. So if somebody makes a misstep, then they get furious. And a lot of the stuff that goes on as far as these conversations online is just a lot of like righteous indignation. People feel like, by behaving in this way, you called down the thunder, and then they feel as though they're equipped to deliver that thunder. And it's just like, not really. Like, nobody is in a position to police anybody else's feelings or, reactions to things. But again, I think to circle back to, if somebody tells you, hey, this is something that could potentially, make somebody upset or many people upset, I think you have to, as a human being, like, try to understand that. Try not to just try to step out of yourself in a constructive way.
Sorry, go on.
No, I think exactly what Chris was saying. Look at what you're doing and ask yourself, how would I feel if somebody was doing this to me? And if you wouldn't be happy about it, maybe that...
I'm sitting here listening to this, and, I really appreciate being included on this podcast today. So one of my future projects that I'm in the process still of researching is going to be physician-assisted suicide for mental illness. Should it be permitted? And overseas in Europe, there are a couple of places that do allow... they frankly call it euthanasia, for chronic mental illness. Whereas, especially here in the United States, in the states where it is legal, the general consensus and the general sentiment is that people with mental illness should not be allowed to do it because, they're not in the right frame of mind, they're not rational, they're not, this, that, some other thing. And a lot of what we've talked about in today's session, touching on, not having empathy, not, if you're neurotypical, you can't necessarily understand what a neurodivergent person is going through or what a person with mental illness is going through. Having empathy for a situation that maybe you can't 100% understand. Because I've encountered, and my colleagues have encountered patients who they've been on slews of medications. They failed scores of medications. Certain medications have made them more suicidal. Their hallucinations have not been controlled. They've been hospitalized over and over and over again with suicide attempt after suicide attempt, or, just frank psychosis, time after time after time. And that person realizes, and even if their family doesn't perceive them as a burden, they feel like a burden and they are not comfortable. They can't get out of bed in the morning. They can't function in normal society. They see the rest of the world functioning around them and they feel like they can't be a part of that, or they don't want to be a part of that. So I've really enjoyed today's conversation. I feel like I may come back and listen to this myself just to, touch back on some of what we've talked about. But again, coming back to these themes of, this mindset of personal responsibility, but then as a society not wanting to be there for those people with invisible illnesses, with neurodivergent tendencies, not wanting to be there or to build a system around those people. so wanting to them to be, you're equal, but you're separate. You have your own issues. You have to figure it out on your own.
Right. Well, and intersectionality is important across the board, I think.
Sorry, go on.
I was just going to say, I think something that people often, just completely miss with things like intersectionality and, all of the things that have been going on in the world lately, Black Lives Matter and things like that, where they want to go, oh, but all lives matter. Of fucking course, Karen, all lives matter. Patty, don't start, we know. It's not saying that. It's saying that these people need to be the focus right now, because these people are the people who are in trouble. So let's rally around the people who are in trouble, and let's get everybody on a level fucking playing field. That's all that that's what people are asking for. Treat every human as a fucking human.
For sure.
Because we all are. Regardless of orientation, race, gender presentation, fucking neurotypical, neurodivergent, everybody has the same... none of us asked to be here, but we're here. So we all have to fucking manage to, get along and hopefully not explode the planet in the process. So I'm learning, as a person who's very pedantic and combative and snarky, but also incredibly, sensitive and depressive, and, it's an incredibly complicated balance to strike, and I miss a lot. My family has had to put up with things and mood swings and, not seeing me for days because I'm, just going to bed and going to my office, and those are the only two places in the house I go. So I feel like if other people could have just an ounce of, okay, this is another human being just at that base level, and I don't want to make this human being feel some type of way. I think that would go a long way to everybody sort of understanding each other better. Are there people that are going to take it to extremes in either direction? Of course. And there are people who, for whatever their issues are just not good people. I'm not going to tell people to have compassion for Jeffrey Dahmer. That guy definitely needed medical treatment, and he needed to be cared for. And I can understand that as a human being, but also he was repugnant and abhorrent, and the things he did were terrible. But understanding that doesn't mean that I agree with it. You know what I mean? And I think people need to work on understanding that other people are still human beings somewhere in there. And every human being, regardless of if they're a monster or not, has an inherent value. Anybody who is here and is trying to better their lives, or is just trying to get through the day, has worth, has value.
Absolutely.
And we have to try to start to treat each other like that, and not just you're encroaching on my freedom of speech, you're encroaching on my opinions, and it's just okay, but if your opinion is hurting somebody, is it an opinion worth having?
Exactly.
Maybe you should re-examine the information that formed that. And some people are not reachable in that way, and it sucks. And I hope one of the things that I hope to do over time with this podcast is I hope people will sort of, get a peek behind the curtain of living with these things, living with chronic illness, living with mental illness, disability, the wonderful spectrum of alphabets, and realize that everybody has some struggle that you know nothing about. And hopefully if somebody listens to this and they hear something that resounds with them, they feel less alone or less lost.
There's I'm going to self-plug a little bit.
Oh, please.
Not because this is the perfect time to get those views, but
No.
You brought up a lot of things that I touched on. So was it 2 days ago? It was International Disability Day.
Mm-hmm.
And I did a 5-part TikTok series talking about my experience with my illnesses. And I talked about how, this is what I have. And some people are like, well, you don't look disabled. And I'm like, well, what does disabled look like? And I ended it on this note of like, I said like, thank you to whoever watched this, especially if you aren't disabled and you watch this to try to get a better understanding of this situation. Because I think when we reach a point where that's going on, everyone's going to be in a better place.
You know, it's funny you bring up the people who don't look disabled, because I do disability exams for the state of Florida 2 days a week, and that's, you know, pretty much part of how we keep our doors open is, you know, doing the work for the man for a bit. But I can't tell you how many patients I will come in, you know, Andrew Yang talks about this mentality of scarcity, and it was kind of the underpinning behind using the universal basic income as part of his platform, but he talks about, you know, the mentality of abundance and the mentality of scarcity. Well, you really see the mentality of scarcity at play with the patients I see coming in for disability, because at least once a day, guaranteed, there will be someone who says, you know, a lot of these people on disability, there's nothing wrong with them. They don't look sick. And I know I don't look sick, but I have things wrong with me. I'm really sick. I'm really in pain. You know, and just this constant, you know, and I understand where they're coming from. I understand their motivations, because, you know, a lot of us are hurting, especially now, at the end of 2020 with everything that has happened. I've had more than one person come in saying, you know, I was put out of work due to COVID, and I figured this was the time I might as well apply for disability. You know, so I understand where they're coming from, but at the same time, for me, as a doctor, as a professional with my own disabilities, and, you know, hearing this kind of language coming out of people that I'm trying to have empathy for is like, I get it. I understand. You're hurting. I'm hurting. Everyone's hurting. And I know that you're desperate for these benefits. But I mean, I'd be lying if I said a part of me didn't want to put up a sign in a clinic that said, these are things not to say to Dr. Hillman. I know I don't look sick, but I promise I am. You know?
Right. They wouldn't, yeah. Right. They wouldn't, yeah. You wouldn't have to. It's so frustrating that is a qualifier. That people have to make.
I'm one of those people that, you know, I look twice at me all day, watch me for days. And you would never know that I actually have a physical disability that nobody knows I even have usually. I have dextroscoliosis, right, which is a section of my back is basically just permanently shifted and busted. But I happen to be blessed with a high pain tolerance. And so a combination between medication as needed and just trying my best to ignore it. Like, I'll spend an entire 3 or 4 hours of gameplay on a Friday night standing by the table instead of sitting, just because I can't sit. But you would never look at me twice and say, yeah, this guy's disabled. It's not just, a lot of people look at it and they go, well, usually when they're disabled, but you can't tell, it's mental. It's not true at all. And just that itself is just a messed up thought. Like, just because I am not bent over in pain 24/7 visibly does not mean that I'm not in pain. Like, I've known people in my past, patients from the Army and stuff like that, who they would use their cane that they were given, but only when they needed to show they were disabled. Like, it wasn't something they necessarily needed to function, but because mentally it would break them down for people to say, well, why aren't you running? I can't. Right. Why aren't you doing this? Because I can't. Meanwhile, like, if they were carrying their cane, that question would never come up. Yeah. They would just assume, oh, he's got a cane, therefore he's disabled.
That's so sad.
It sucks that you kind of have to do the emotional labor for people sometimes, because I've been in that situation where, like, I don't always need a cane to function, but I have a wheelchair too. I don't always need the wheelchair. And I always get a pang of anxiety when I try to stand up out of the wheelchair and walk around when we're out in public, because I feel like people just see a fat person in a wheelchair and then they see that person get up and walk around and they go, oh, she's not really disabled. Like, I have a placard. I have 8 doctors that'll tell you, like, all of the various parts of my body that are fucked up. I assure you, all of this is necessary. I don't just want rock star parking. Like, yeah. And it's one of those things, like, you have to... Sometimes it almost feels, like, performative. And I hate that you... Like, that has to be a thing for people to have any sort of empathy.
I have a friend who uses a wheelchair and has crutches and whatnot. But if you took a look at her, she's incredibly thin, and you wouldn't like think at first glance that she has issues where it is important that she uses a wheelchair and crutches. And the amount of times people have just completely dismissed her because of that, it's so sad, and it's, if I'm going to be frank, it's infuriating, because I also think people don't realize, especially when we're talking about getting the actual like stamp or whatever that's like disabled, like to get that thing that says you're disabled, the amount of things you have to do is crazy large and takes so much time and so much effort that I think if a person tried to do that, just like for lack of a better term, a normal person, they would be like, what? Like,
if you laid out every appointment you had to go to, or every specialist you had to see, or every, I can't tell you how many like new patient forms I fill out in my life. And often an average person will have only seen like a primary doctor and maybe 1 or 2 specialists over the course of their life. Meanwhile, it's astonishing at times, especially like when I've been in the hospital. I'll meet 8 doctors in a day that I've never seen before. And now I have 3 new appointments I have to make after I get out. And then, all of those appointments have follow-ups, and I have to call the insurance, and some of them require medication. And then, back when I was on opioids, I had to go, even though it was physically painful for me to do so, I had to go to the pain management doctor I was seeing in person, like every other month, and sit through an hour in their uncomfortable waiting room, and then sit for 20 minutes in the exam room, and then half the time not even talk to my doctor. I would talk to a nurse practitioner in the office or something of that ilk, just so that they could sign this slip to give me more of the medication that I had already been taking for years at that point. And I understand we had a crisis and have a crisis going on, and I'm glad I'm not on opioids anymore. I never had an issue with it, thank God. But I understand why they have to be rigorous in their oversight of that. But I think patients get punished in that process. And people don't understand the enormity of finding the diagnoses. I walked by my dad in his study on my way to do this podcast, and he was like, "Are you okay? Like, what's going on?" And I was just like, "Yeah, no, I'm not okay. I'm sick. What are you talking about? Of course I'm not okay. Are you new? Like, I was in the hospital a month ago. Like, I'm sick all the time. You just don't, you're not always, in the library when I'm not feeling well."
Yeah.
And, I think that because if people don't witness it constantly, that it sort of goes to the back burner, and that's fine. Like, I don't want people to go, "Oh, there's Ellie. She's fucking sick all the time. She wakes up nauseous. She's got chronic pain or whatever." But at the same time, like, if you don't talk about it, it's such a strange sort of balancing act, because if you never talk about it, then people sort of forget that you have any sort of ongoing issues. And if you talk about it a lot, people can perceive it as like kvetching or being a bummer. And so, like, for me personally, I'm always like, well, should I say stuff? Should I be public about this? You know, I'm really sick today. Do I say something about it online? Because I do have a public-facing social media presence, you know, or do I just go radio silent? And as of late, I've started more and more being like, no, I'm just going to be honest and be like, hey, today's really rough, but I'm really glad I have my friends. Or, you know, today I didn't hurt as much as usual, so I'm really happy. And I'm just trying to be very transparent with things as far as that goes, because, like, seeing accounts like yours, Mike,
you can't say this, but I'm making a cute face like, ah, but go on.
It touched me, especially because we have known each other sort of peripherally for like years. And I did not know that you were dealing with these illnesses. And this is a podcast that I tried to start 2 years ago, recorded one episode with a friend, and then got too sick to edit. And so I abandoned this. So this phoenix of a podcast that we're doing now, you know, I hope people will be able to find some sort of, I don't know, camaraderie or solidarity, or maybe, as I said, incidentally learn something, or at least understand the people in their lives better, understand that the people they care about are dealing with things, you know, far more intricate than it would seem on the surface. You know, ducks are calm on the surface of the water, and they're paddling like crazy underneath. And I feel like that's very apt to sort of what dealing with these things is like, and what living this life is like. Chris, I see your message. So I guess to sort of bring all of these disparate things together, I think compassion and empathy go a long way for everybody. And I think being kind to ourselves, being kind to each other, trying to show up for ourselves as much as we show up for other people in our life, is hugely important. I don't know if you guys have any like final advice you'd like to give, or you know, plug anything you guys want. I definitely want to hear more about this this documentary.
Yeah, we'll definitely be putting out updates for it. So I just filmed my first interview this weekend yesterday, and I'm going to be going out to Arizona next weekend to film my next interview. And then January, I think I have like 5 or 6 people lined up across 3 states that I'm going to be, you know, kind of blitzing along the way and trying to get as many people on tape. And my goal is to release by Pride 2022. I figure that's, you know, enough time to get everybody on tape and put it into some sort of coherent project. But, you know, and like I mentioned, I'm starting research into other projects as well. So hopefully we'll get things going.
It's been interesting trying to get the filming and the things done, and the way things are right now with the ability to actually go to the state.
Well, you know, that's actually something. That's actually something that you could take a look at. Is
yes,
what we're doing
we
today.
We have looked
Discord.
at that as potential for different
has a video function,
different transitioning pieces, especially. But it's been a little interesting, and then we've also again, we haven't stopped clinic to do this, so we're still doing full-time clinic and then adding this on.
Right.
So it's been a little interesting trying to shuffle things around and get things together. We are hoping to go up to Philly to shoot up in Philly. I don't know. We don't really have... We're looking at March or June, depending on a bunch of different things. I'm probably going to go ahead and say probably closer to June. Trying to get the children. So I'm homeschooling as well. So
you guys are
our youngest can't go to this school right now because of he has a heart condition that makes him very vulnerable to COVID. So I'm at home teaching them and going into the clinic to do the financial and the regulation part of crap. And so it's a lot of us trying to figure things out. On the bright side, it means that the kids can hopefully end early this year.
Right.
And
that would be cool.
it'll make it a little
that would be
easier
cool.
for us to get a lot of this done.
But if people want to follow the clinic or the production company on Facebook, that's where we're most active. The practice is called Pensacola Osteopaths, Osteopaths. And then the film company is called 61 Hotel Productions, which is a nod to what my MOS was in the military, 61 Hotel Family Physician.
That's awesome. And we will make sure to put links to everybody's social media and all of the information for the documentary in the information section for the podcast. And Mike, what I know that you're doing your TikTok, and you're also an incredible photographer. What are you currently working on?
So that's a very good question, actually. Right now, I'm doing some photo stuff for a client, but I'm trying to... Man, I really wish my brain would stop doing this ADH thing right now, during the podcast. After's fine, but not during.
Oh, don't feel any pressure. It's fine.
No, I know. I appreciate it. Right now, I'm just doing a lot of video editing. I do video editing for producer Simon Servita. I might be doing some video editing for someone else, a really good friend of mine. But in terms of personal projects, I enjoy making short videos because they're short, so I have the energy to actually make them. Which is why I love Instagram and TikTok for that sort of thing. And it's been a lot of workout videos. I need to get back on the thing because the, in quotes, bipolar thing hit, and it's been taking a lot of energy to get back on the horse. But also talking about, the stuff that I have going on in here, but also just trying to be honest and fun and entertaining, and even if I can manage it, hilarious. But that's about it. And most of my socials are M Dosik, so MDOSIK. Typically, if you search that, you'll find me. So,
and I'll make sure everybody's socials are included. I would like to thank everybody for joining me today. This is the first episode of this podcast that we've done. We have some guests lined up. Maybe if you're listening to this on YouTube, you will have heard our opening theme, which was produced by Megaran. So that was very exciting and very cool of him to help out with this project.
Wait, seriously?
Yeah.
Oh, wow.
Yeah. I reached out to him, and he's going to do the intro theme for me.
That man. Bless that man.
He's definitely an amazing producer. We just released a track with him on Halloween. It was an Among Us rap, so it was pretty great.
Nice.
So I want to, like I said, I want to thank you guys for joining me, and for making it so easy to record this episode, because talking to all of you has been absolutely lovely. And I feel like I've learned some things, and I definitely feel like heard and seen by you guys, and hopefully you guys also feel heard and seen, and hopefully this helps somebody.
Absolutely. Thank you for having us.
Yeah. All right. And I'm gonna stop the recording, and then I'll record like a separate outro.
Sounds good. I'll definitely check out the 61 Hotel Productions and stuff. And thank you for sharing all that you shared.
Yeah, thank you, everybody. I honestly could not have expected this to go as well as it did. Thank you guys for being so helpful and so open, and for doing the things that you're doing, and for helping me out, because you didn't have to do that. No, you guys sounded fine. There was like a little bit of a shuffle noise when you guys were switching, but I don't think that'll be a big deal to edit out. Yeah. Also, Mike, I wanted to ask you, do you care would you prefer if I left in the times where your ADHD kicked in, or would you like me to edit those out? Because I can do either.
No, I keep them in. This is a podcast about, chronic stuff. Let's be honest about it.
Yeah, that's fine. I am going to go through and like deaden, I think at one point sirens went by. If I can get that out of my recording, I'm gonna, and like, I might like snip out some additional ums or anything like that, especially on my part. I know I say it a lot.
No worries.
Well, hey. Okay, good. Yeah, this mic is, I'm 2 feet away from it. It's a great mic, but it will pick up, like, environmental sound a lot. I probably need to put a pop filter on it or something.
I gotcha.
But thank you, guys. I really appreciated it, and I'm Chris and Lex, I'm sure I'll talk to you much more. And Mike, I hope we talk more after this, because it was really lovely having you.
Yeah, absolutely.
You know what to do. Chilling out, maxing, relaxing, all cool. If you're listening to this, then you know what to do. Lay back, let your thoughts sink into the groove. Cause we got a special message and it's just for you. Check it. I know that you're exhausted in pain, and the stress of the world is driving you insane. Seems like nobody understands. Not your co-workers, your friends, or your fam. Close your Facebook, Twitter, and Instagram, and lay back, meditate, play this jam. Cause life's hard enough. Sometimes you need charging up. I'm here to let you know you are enough. Stay locked in when it's too much to deal with. I'm here to give you an overdose of realness. Healing, oh yeah, that's the business. Mega Ran, Ellie Rocks, chronic chillness. Chronic chillness. I know how you feeling. Come and take a seat. Feel the beat for some chronic chillness. I know how you feeling. Come and take a seat. Feel the beat